Hello and welcome. Today we'll be exploring a rare neurodegenerative disease called corticobasal degeneration, or CBD. This progressive condition affects movement balance and cognitive function. While relatively uncommon, understanding CBD is crucial for both patients and their loved ones. The exact cause of corticobasal degeneration remains a mystery. It's considered a sporadic condition, meaning it doesn't typically run in families. Researchers believe that a combination of genetic and environmental factors may play a role in its development, but further investigation is needed to pinpoint the precise triggers. CBD's hallmark is the buildup of a protein called Tau within brain cells. These Tau proteins become abnormally folded and clumped together, forming what are known as neurofibrillary tangles. These tangles accumulate particularly in the cortex, the outer layer of the brain responsible for higher-level thinking, and in the basal ganglia, which controls movement. This accumulation disrupts the normal functioning of these brain regions, leading to the characteristic symptoms of CBD. Corticobasal degeneration is a relatively rare disorder. Estimates suggest that it affects around 4 to 5 people per 100,000, because its symptoms can overlap with other neurological conditions like Parkinson's disease or progressive supranuclear palsy. It can sometimes be misdiagnosed, making it difficult to determine its true prevalence. The signs and symptoms of CBD can vary from person to person, but they typically develop gradually and worsen over time. Common motor symptoms include stiffness, rigidity, slow movement or bradykinesia, tremors, and difficulty with coordination. A distinctive feature is apraxia, the inability to perform familiar, purposeful movements despite having the physical ability to do so. Cognitive symptoms can include problems with memory, attention, language, and executive function. Behavioral changes like apathy, irritability, and anxiety can also occur. One side of the body is often affected more severely than the other, a phenomenon known as asymmetrical presentation. Diagnosing CBD can be challenging, as there's no single definitive test. Doctors rely on a combination of factors, including a thorough neurological examination, a review of the patient's medical history, and neuroimaging studies like MRI or PT scans. These scans can help visualize the brain's structure and function, looking for patterns of atrophy or abnormal Tau protein accumulation that are suggestive of CBD. Blood tests and other laboratory studies may also be performed to rule out other conditions that can mimic CBD. While there aren't distinct subtypes of corticobasal degeneration based on underlying pathology, the clinical presentation can vary. Some individuals might primarily exhibit motor symptoms, while others may experience more prominent cognitive or behavioral changes. These variations in presentation can sometimes be described as different phenotypes of CBD, reflecting the diverse ways the disease can manifest. Unfortunately, there's currently no cure for corticobasal degeneration, and no medications that can slow or stop its progression. Treatment focuses on managing symptoms and improving quality of life. Medications like levodopa, commonly used for Parkinson's disease, may provide some relief from motor symptoms, although their effectiveness is often limited in CBD. Physical therapy, occupational therapy, and speech therapy can help maintain mobility, independence, and communication skills. Assistive devices, such as walkers or wheelchairs, may be necessary as the disease progresses. Supportive care, including counseling and support groups, is crucial for both patients and their caregivers. As a sporadic disease with no definitively known cause, there is no way to prevent corticobasal degeneration. The prognosis for individuals with CBD is generally poor. The disease is progressive, meaning symptoms worsen over time, and there's currently no cure. The average survival time after diagnosis is around 6 to 8 years, although this can vary depending on the individual. Recent research is focused on developing new diagnostic tools and potential therapies for CBD. Researchers are exploring strategies to prevent the formation of Tau tangles, clear existing tangles from the brain, and protect brain cells from damage. Clinical trials are ongoing to evaluate the effectiveness of various medications and other interventions. Advances in our understanding of the underlying mechanisms of CBD hold promise for the development of more effective treatments in the future. While a cure remains elusive, ongoing research provides hope for improving the lives of those affected by this devastating disease.